and I don't need it. I'm going to tell you, when my children were born, they were all adjusted within 1 week of birth.
What?
Uh-huh.
Hello, and welcome back to the Balance to Excellence show. Thank you for being here. If you've been here before, welcome back. And if this is your first time here, welcome. And please like, share, subscribe, and comment. We love to see and read your comments. And today, I have the pleasure of interviewing with Dr. Jonathan Sirota, okay? And we're going to be talking about, as we often do, holistic healing. So Dr. Sirota has been a dedicated solo practitioner in chiropractic medicine since 1990. So I'm not trying to date you, Dr. Sirota. It's over 35 years of expertise in treating neck and back pain, sports injuries, and accident-related trauma. And he's recognized as one of the best chiropractors in Westchester, New York. And he's known for taking on very challenging cases. He often treats patients that went to other chiropractors and medical doctors, and it didn't work out. So he has offices in New York, he has offices in Connecticut, and he is committed to helping his patients find real relief and lasting recovery. Dr. Sirota, welcome to the show.
Thanks, Dr. Judy. It's great to be here. Thank you for having me today.
Thank you. Now, I'm going to drop a truth bomb.
Go ahead.
Okay, I've never been to a chiropractor, but it's because I'm lucky enough to not have back pain. Like I don't often have back or neck pain. I probably had bad neck pain once many years ago.
Mm-hmm.
And other than that, I think my husband needs someone like you, but I've been lucky enough not to. So I really want to understand more about it. When I was seeing patients, I often said, have you tried when these other things didn't work? And I'm not a big, humongous take medication all the time person.
Mm-hmm.
So I'm like, have you tried going to a chiropractor? Have you tried doing this, doing that? What inspired you to become a chiropractor?
Well, I have to thank you. Thank you for that introduction as well. I have to respond to your initial comment, Dr. Judy, about how you said I've been lucky enough to not need a chiropractor. That right there is a whole hour and a half conversation.
Okay.
We're not going to do that. I'm going to get to the gist of it right now, and then I'm going to get into, I'll tell you why I became a chiropractor. Okay. Here's the deal. Often I tell my patients, I don't want you to call me doctor. I want you to call me John. Because in this country, if I'm calling you doctor, that makes me what?
What does that make you?
A patient.
Yeah.
If you call me doctor and you walking in to get care, you're the patient.
Yes.
In this country, all of a sudden, the paradigm is doctor-patient relationship. You're locked into that. It must mean there's something wrong with you.
There's something wrong. My goodness.
We opened with you telling me that, thank goodness, and yes, I agree, thank goodness, and we all want, which brings me into the reason why I became a chiropractor, what drew me in, okay? When I was 18 years old, I had a horrible experience growing up in my house. My parents were always in the midst of fighting and horrible and ended in divorce and everything. And it was very, very stressful. And I internalized that in neck pain. And it was horrible, horrible neck pain. I had a girlfriend who was working on my neck. She would massage my neck all the time, you know. And one day she said to me, I love you, but my hands are going to break. You're going to have to go see a chiropractor. And I was like, what is a chiropractor? And she said, well, I think they work with your neck. I want you to go see Dr. Richard Nunziata, who's a friend of mine now for many, many years. He was her middle school teacher that went back to school to become a chiropractor. Long story short, I go visit Dr. Nunziata. I drove my mother's car to his office, and I'm going to use a dirty word. He cracked my neck, okay? We don't say crack. We call it an adjustment. But he cracked my neck. That's to get the point across to the audience. They know, know what that is. So I felt immediate relief, immediately. And I didn't know what he did. I just felt great. Got back in my car, was driving home to my mother. And at that time, I had just taken the optometry college admissions test. I was going to be an optometrist. And I got a 98 on that test. And I said, wow, I'm going to be an optometrist. All of a sudden, I was shaken. I didn't know what happened. I was just totally blindsided by that visceral experience of getting my neck adjusted and me feeling great instantly. All he did was put his hands on me and move me around and made some clicking noises, and I felt amazing. So I'm halfway home, And I see myself thinking, well, my mom's going to ask me what happened, and I don't know what to tell her. So I hit the brakes, made a U-turn on Nostrand Avenue in Brooklyn, turned around, went right back to Dr. Nunziata, walked in his office. He says, "What's up, John?" I go, "I have to ask you, what did you do?" He goes, "What do you mean? You all right?" I'm great. I go, "What did you do to me? What happened? Explain this to me." And he goes, "All right, can you see this?"
Yes.
That's what he
Very
did.
well.
That's what he did. And I was, "What are you doing?" He goes, "Look at that. The chart of the effects of spinal misalignments. This is like a circuit breaker in your house," he said. "It's called your spine. You came in, John, because your neck is bothering you. Okay? That's neck pain over here. All right? We trace it back. The nerve that feeds the neck is at the cervical spine, C1 through C7. All I did was crack. I adjusted your neck, freed up those vertebrae, which took pressure off these nerves, which freed the muscles that were causing your pain, and you got better." I said, "What?" He says, "That's it. It's simple. I didn't need a prescription pad. I didn't need a pill. I used my hands on you." I said, "Well, what happens down here?" He goes, "That's simple. Start here. People come to me with low back pain, problems with bowel issues, and all sorts of maybe sexual dysfunctions, both male and female. We trace it back and we find out that the lumbar nerves feed those areas. Well, are we saying that everything that has to do with illness is caused directly to the spine? No, but it is contributing." He said, "If you have any issue here, you best believe that if you have a blockage somewhere along here, you're not going to be as good as if you were if I freed that up for you." And what's missing in this picture? The brain. The brain is the Con Edison or Verizon Wireless, as I talk to my patients, right? And you want 5 bars all the way down here by your toes, and you want 5 bars on your eyes, ears, nose, throat. So this is the sheet that he showed me. So I take it home and I showed it to my mom. And before I left, I'm looking at him. He's alone in his office. There's no staff. I'm like, "How do you get patients?" He goes, "You walked in." I go,
Word of mouth.
"You make any money?" He goes, "You just gave me $50. You go on vacation?" And you can see what's happening. I'm shifting. I'm like, what the hell? So what happened was it was visceral for me. It wasn't cognitive. It wasn't like, I think I'm going to be an optometrist because it's a good field. There's a demand for optometry. And, it wasn't like cerebral. It was visceral. I felt so, and the statement he said was, "Your body will heal itself. I just need to get rid of the interference." And I said, "With your hands?" Yes, and we're not limited to the eyes. It's the whole body. And this comes from Grey's Anatomy. You studied this.
Yes.
This is page 4 out of Grey's Anatomy, 20. And the nervous system controls and coordinates all organs and structures of the human body. Grey's Anatomy. Misalignments of spinal vertebrae and discs can cause irritation to the nervous system and affects the structures, organs, and functions, which may result in the condition shown below. This is all encompassing for me. So I dropped everything and I said to my mom, "I want to be a chiropractor." And that's what it was. That's what it was. It was, and he told me, "You're going to come up against resistance." He goes, "We're not really loved by the medical field at this time, 36 years ago." I was like, how could you not love the concept of simplicity, of reducing something that could be interfering with your health with your hands? What's not to love or understand? It's so easy. He goes, "Exactly. That's why I'm a chiropractor," he said. And you know what, Dr. Judy? It didn't matter to me what any obstacles I was going to come across. I didn't even care. This to me, 36 years ago, is just as relevant today, you and I having a conversation now, as it will be 100 years from now. This will never change. But we're going to have new weight loss drugs, and we're going to have a new iPhone, and we're going to have a new... But this never changes. So I was drawn into that, and I anticipated you were going to ask me this. That's what happened. It drew me and it sucked me in, and it said, "You don't want to be a physical therapist," because I looked at that and it was boring. It was boring as hell, right? It's like physical therapy, the arm stuff. Is it good for people? Yeah, it's wonderful. Physical therapists, they all do great things, but they treat the diseases that have the body, whereas chiropractors treat the body that hosts the disease.
That is a fabulous way to, wow.
And so when you say
Never
to
thought
me,
about it that way.
when you say, "Thank God I'm okay and I don't need it," I'm going to tell you, when my children were born, they were all adjusted within 1 week of birth.
What?
Uh-huh. Yeah. There's nothing to crack. There's nothing to snap, crackle. My wife was holding my kids on her, burping. So
Yeah.
I'm up behind, one hand on her, 2 fingers running up the spine until I felt a little resistance, a little massage, and all of a sudden you feel something palpably move, and the baby just relaxes, closes the eyes, and goes to sleep. Now that's nature. It's
So
and very,
let me get this straight.
yeah.
Because now we're gonna veer off a little bit. I'm bringing back. I need to veer off a little bit.
Okay.
So You know how we have all these little colicky babies go through colic?
Yes,
Can adjustments help that?
they have. In October of 93, I wrote an article for the Brooklyn, I was interviewed for an article for the Brooklyn Parent magazine. It was a Halloween edition. I have it on the wall somewhere. And I was quoted as saying that my kids never got sick. And it's true. They never got sick. Knock wood. And the reason is that they've been adjusted their whole lives. And so their immune system is functioning at 5 bars. Let's use the metaphor of the cell phone. Whereas, listen, doc, you're a doctor. You know people who always get sick no matter what.
Yeah.
And you know people that never get sick.
Yeah.
It's an immune system thing, right? So we're trained to know in medical school that at 4 weeks of gestation, we have the brain and the primitive neural tube. It's not even a spinal cord at that point. It's the neural tube. It looks like a big taco, right? And then that starts to develop into the full spinal cord and the central nervous system and all the nerves that come out, and then the organs attached to those nerves. Everything comes back to that central nervous system, and that's why chiropractic works. And that's why I adjusted my kids. And it's funny because she's my ex-wife. She's an RN, and this is hilarious. You might want to edit this out, but anyway, she says to me, "Oh wait, no way in hell you adjusted me. You're not cracking my neck." She goes, "We could have sex all day, but you ain't adjusted me." And I'm like, "Yeah, you don't want to get adjusted. We should get naked." Funny as hell. And I'm joking around, and then of course, the kids are born, and we got the kids adjusted, and as she started to see that they were having play dates with their friends, and the friends were getting sick, and we would get phone calls. "Dr. John, this is so-and-so. I want you to know that Helene was playing with my daughter, Abigail, and Helene's in the hospital with double pneumonia. And I just want to give you guys a heads up. This is an 11:30 at night phone call on an answering machine. Just want to give you guys a heads up to look out for symptoms because I know Abby was playing with them. And by the way, how come your kids never get sick? Okay, we'll see you guys tomorrow at school." And we're laying in bed listening to that, and she's looking at me and I'm looking at her, and it's in this country, they don't get it. They don't get it. They don't get it. Every single human being needs to be adjusted to remove the interference that is inborn in us that heals us. We heal ourselves, right? From above down, inside out. And if we start chasing symptoms like whack-a-mole, as the system is currently set up in this country, and I'm not demeaning medicine at all. I mean, I've had surgeries, I've had visits with doctors, I need medicine for certain things. But I think the first step should be to get adjusted. Remove the interference in your spinal system, in your nervous system, and see what your body can do on its own, and then resort to other medications if you need.
Yeah. It's amazing. First of all, that's such an amazing story. Your journey is an amazing one. But just listening to you, so I was one of those kids that, one of the reasons I'm a doctor is because I loved going to doctors. And I loved going to doctors because I was going to doctors a lot as a little kid. Not because I had like really major problems, but I would get sick. I got a lot of colds. I had a lot of GI symptoms as a kid all the way up into like my 20s. And, in the last few years, as I really addressed how I deal with stress, right? I was always the first one in the house to get sick.
Oh,
Now I'm like the last one in the house to get sick, right?
interesting.
Just that change. And if I had pain, I used to take pain medication on a dime. My friend used to be like, "I'm going to tell your mother you took too much Motrin, da da da." Now I'm just like, people are like, "Did you take something?" No, I know how to deal with it. Like, so just the way that you address it, I feel like not doing all of that has helped my immune system. Do I get sick? Yeah, I do sometimes. I mean, I was just sick the other day, and I told my husband, "You brought me the cooties," because he works in the hospital. Like, "You brought me the cooties," right? But I was able to shake those chills off in like the chills and even the feeling of being sick in like 36 hours. I was just, so my recovery time, I notice, is different as well. Just by, how I deal with things has really helped my immune systems. Listening to you talk about how chiropractic medicine helps with that as well. I stand corrected on the whole thing about not needing a chiropractor.
I can't wait to get my hands on your neck.
I stand corrected on that. I think that's absolutely amazing that how that weighs in, and that's all stuff that I learned, but not to that level.
Right.
So thank you for that lesson. Do you usually give your patients that sheet? Because you said it in such an understandable way.
Every single person that walks into my office knows what chiropractors do, irrespective of how I'm getting paid. And I'm going to tell you why I said it that way.
Mm-hmm.
When we used to get paid from insurance companies, you and I, way back when in the old day, when the insurance companies pay for things without all these denials and delays and all this stuff, a lot of chiropractors felt they didn't need to convey what chiropractors really did with patients because it took a lot of time. You're a patient, Dr. Judy, you walked in. I want you to understand what it is that chiropractors do that is so different than any other practitioner available anywhere. And what it is that when someone's paying the bill for you to come see me to adjust you, you're kind of half listening. You're really not committed. It's not like you're paying for it.
That's true.
Right?
That's true.
Well, I told them from the get-go. People came in and they say, I'm here because my neck hurts. I'm here because my back hurts. It was one or the other. And I'd say to them, okay. And I wanted to meet them where they're at. And, if they're telling me that they're here for neck and back problems and I start talking spinal cord and this, I'm losing them, right?
Yes.
So there is a component to this conversation where I'm going to say the neck and back pain goes away as a side effect of what I do, not the main effect. Well, what is the main effect? The main effect is I'm reducing interference in your nervous system by taking pressure off a nerve that might be causing direct pain, like a lumbar disc on the sciatic nerve, or cervical disc causing herniation in the cervical spine with numbness and tingling in the arms, hands, and fingers. That's very real. So there's a mechanical component to that, of course. By getting an adjustment or manipulation of the spine, we can reduce the pressure on a nerve and directly affect somebody that way. And then we go back to my original statement about the whole body and the whole balance of the purpose of chiropractic to remove interference. There's both of those happening at the same time. Now, you talked about what appears to be your stress level under control now is the reason why you're not getting sick. Is that correct?
Yeah.
Right?
Yep.
You're managing it. Guess what? Between T1, and you know this, between T1, first thoracic vertebrae, and L2, that's 90% of your spine right there. Between T1 and L2, we are wired for fight and flight. Any one of those vertebrae get hung up between T1 and L2. That's your whole thoracic spine, every thoracic vertebrae, your whole back. Any one of those gets hung up, and you're now sitting at a red light with your foot on the accelerator, but the car's in park. And those are the people that come in and they're like, I just can't dial it down. I try to lay down. I can't rest. I can't. I have to. Maybe I need to meditate.
Yes.
I am jacked. And then I feel that spine and I go, man, you are jacked. And they go, what do you mean you feel it? And I go, I feel it. And I explain to them, I teach them. If you're stuck between T1 all the way down to L2, your body is in a state of preservation of species. You're in sympathetic dominance, opposed to parasympathetic. And by me adjusting the spine and restoring normal function, taking the pressure off these nerves that are causing that fight and flight response, half of them fall asleep on the table right in front of me.
I can believe that. I can believe that.
Right in front of me, their eyes start to close, and because it's almost like you exhaled. You're able to exhale. So I hope I didn't get off track too far.
No, I think that's the kind of thing that people need to understand, that there's so much in our bodies that if we allow our bodies and our mind, that if we allow it to, can help us heal ourselves.
Yes.
And how it is all so very interconnected. You actually answered one of my questions, because I was going to ask you what's the biggest misconception, and I think it's that I'm here just to treat my pain.
Thank you. That's such a relief to hear those words coming, because I know that I explained it. That's what it is. That's the biggest misconception, is that I like you say, well, listen, when you go to the gym and you go to the, it's like you go to the gym to make your body stronger and healthier. It's no different going to a chiropractor on one end of the spectrum, and it's a double prong, right? The other end is the part that is the sciatic pain, the neck pain. It's wonderful at reducing pain, chiropractic. It's immediate, because there's a nerve being compressed and I'm decompressing it with my hands. So it's immediate relief. So on that prong, it fits into the paradigm of the American medical system, where Dr. Judy comes in and she has low back pain. The pain is radiating down the left butt cheek, and then it's going down the left hamstring, and then it's going to her foot, and now there's numbness and tingling in her foot. And I label her with an L4, L5 disc herniation. And then I submit that to your insurance, and your insurance says L4, L5 disc herniation. Yes, we cover that. Let's pay Dr. Sirota for that. And then you refer in your friend Josephine, and then Josephine comes in and says, I got nothing wrong with me. I just want to get adjusted to feel better. And I say, I wonder what the code is for that. There's no code. Well, call your insurance. Well, Josephine wants to get adjusted because she wants to feel good. Ha, ha, ha. We don't pay for just wanting to feel good. We need something wrong to pay with. So all of these chiropractors had to figure out how to play the game. And it became very medical oriented where, it was a knee jerk reaction where now we had to do what we needed to do to play to the system to get paid, to live. And brings me back to my last comment. I don't want to go too far off topic here. What I want to say was, again, coming back to when insurance paid us well, it was incumbent upon the chiropractor to explain to his or her patient that this is what's happening and take the time to explain it and not wait 36 years where we are right now, where there is virtually no more insurance and deductibles at 10,000 and nothing's paying for nothing. And now the patient pays out of pocket. And now they really want to know why they need to be here. Now you really have to sell them. Well, guess what? My dialogue hasn't changed in 36 years. I said the same thing when I was getting paid from insurance companies as I'm getting paid from the patient. So because I cared. I needed the patient to know that there is no alternative to a chiropractic adjustment. You can go to any doctor you want for pain relief. You can go to an orthopedist. You can go to a neurologist. You can go to a pain management. You can go to family medicine. You can go to physical medicine. You go to physiatry. You could do acupuncture. You could do homeopathic medicine. You could do Ayurvedic medicine. You could do any of these different things. There's only one profession in the world that's going to balance you from head to toe, irrespective of why you walked in that door, and that's a chiropractic adjustment. And the purpose of physical therapists now learning how to do manipulation is they are competing with chiropractors in their mind, but it's really a different thing. They're learning manipulation of a joint, or they're learning manipulation of the cervical spine, not to the degree that we do it, for the purpose of restoring function to relieve someone's pain, not having anything to do with balance and restoration of the sympathetics and parasympathetics, the whole human being, the balance. So that's really what drives me, Dr. Judy. That's what keeps me passionate. I'm doing this 36 years now. I'm just as passionate as I was when I started in 1990.
Yeah. And you said something really important throughout. You didn't change because the body hasn't changed. Right. And with all these medications, I could tell you as somebody that hasn't practiced in some years, sometimes when I hear these medications, I'm like, what? Right? Like, how there's certain medications, they fall in the class. And so the end part of the name sounds the same. I feel like even that's going, like they ran out of those. So now they're coming up with names that sound like dances. And, there's just so many, and when you come up with these different treatments, that changes because we start a treatment now, we don't know the overall effects of that treatment or side effects for years to come, and things like that, but the body itself doesn't change.
It hasn't changed. The body's the body. God made a beautiful machine, and we do heal from inside out. I used to do lectures to my patients in the early days. We would have an orientation, and I'd bring in the patient and their significant other, and I would have them sit down in my office, and I created a flip chart, and I would show, I literally brought it back to the sperm and the egg. This is the sperm, this is the egg, this is the cell. The egg gets planted in the uterus starts to grow. 4 weeks later, you have a primitive brain and primitive spinal cord, and I had this all drawn out, and then we'd show the organs, and then they remembered that. And they said, why didn't anybody else teach us this, that this is how our body works? And if I knew this, I would have been here before. And why don't people tell us this? That's the number one question I got. And it takes time. It takes time and energy to do that, to convey that to every single patient. And
yeah, it does.
We get tired. We don't want to work that hard sometimes. You just want to treat a patient and go home.
But also, it's often trying to find ways to say it. I'm just going to say it, especially when you're dealing in a routine medicine, and then you have these appointments and you have 15 minutes to deal with, and part of that 15 minutes is actually documenting. So now let's cut it down to about 12. All right. And in that 12, you have to get to the root of the problem when your patient doesn't always know how to speak the issue. They're going to tell you this, you got to figure out the underlying part. What is the part that's not said? What's the part, and a lot of times it ends up being Band-Aids put on visit after visit after visit after visit. Right.
That's right. You're talking about a consultation being super fast. You got to figure it out quick.
Yeah, yeah, yeah. And so, and that's why, when I talk to anybody that I'm talking to, even on, the professional level, I'm like, you got to look at your underlying stuff. You got to look at how, for me, I talk a lot about stress and balance. How's this affecting you
Yeah.
and in your life? You got to look at how that interplay is happening. What is the foundational cause of what's going on?
Wonderful. I love that you said that.
Yeah.
I find most medical, a lot, not most, well, a fair amount of medical people, because of the constraints put on them by the system, like you were illustrating earlier. I have to make quota. I got to see 30 people today. They're going to come down on me, an emergency medical room person, or, and I'm like, really? That's what corporate's about? They're making you do that, and like, wow, where's the patient care?
Right. Right.
Where's the compassion? When they leave, they want to feel like they've been cared for or heard.
Right.
Um,
And Dr. John, it plays a big role also on those who are taking care of the patients too, right? Because they know why they came in. I know that was a big stressor for me, right? You know why you do what you do. And then you're like, am I really getting to do what I came here to do? Right. So
right.
that is a big stressor, because if you're thinking to yourself, I have to see this amount of patients and I have to get through this, that impact on the psyche is a lot. And you really want to be able to truly care for your patients and not just put a band-aid on it. And so when I talk to even medical professionals about that, I address that. I get what they're feeling. I get how stressful that could be, the role that's playing on, the work that they do every day, but also what they take home with them every day.
Yeah, it's not very rewarding to feel that frustration
Yeah.
that you can't spend the time. When I started 19, maybe the first 10 years, because of the business model and what was available to me insurance wise to make a living being a chiropractor, I was seeing 75 people a day myself. Yeah. We had 5 adjustment rooms going. This is in Brooklyn on 86th Street, Bay Parkway, Bensonhurst, Brooklyn. We had 5 adjustment rooms
Go
going.
Brooklyn.
And I spent 6 minutes with each patient. My therapist would go in before me, a massage therapist after her, and then I come in and adjust the patient. And still then, true to what I said earlier, I would explain what chiropractic is, but I didn't do it one-on-one. I had them come to a class, an orientation class.
Okay.
We would do in large numbers. I have much more gratification now because I spend 45 minutes with every patient that walks in. I get to know them. We laugh. I can be crazy and funny, and they feel cared for. And I get to the root of the problem. And on my website, I have it said right there on the front page, give me 5 minutes and I'll figure out your problem. That's the fun for me. It's like a Rubik's Cube. I got to figure out the problem.
Mm-hmm.
I'm not going to be another Band-Aid. I'm not going to ask them to sign up for $5,000 worth of care that they don't need. I'm going to talk to them like a human being and bring them along and let them understand what's wrong, what's going wrong. A lot of times it comes down to their feet with back pain. 85 to 90% of the time, people have flat feet that cause hip problems and back problems. And I'll say to them, you know what?
Flat footer here. I'm like, oh.
Me too. You know something? I have a 25-year-old sitting across from me in a consultation, 30 years old. And this patient says, I've been in pain for 6 years. It doesn't go away. You're 30 years old. Why isn't it healing? Let's look at it. Let's look at it macro, okay? Maybe you had a disc bulge. Maybe you had a hernia. But I know, and you know, that the body can heal. Why isn't yours healing? Why isn't
yours healing?
Why isn't it healing?
At 30.
Let's address it. Let's see what we missed, what they missed.
Yeah.
Brought you to me. Well, take off your shoes and socks. Let's get you on the scanner. Let's see your feet. Let's see the foundation of your body when you stand and your weight bearing. And all of a sudden, it's crazy. It's off. And I say to them, look, you need orthotics in your shoes to help you stabilize and keep the adjustment that I'm going to provide to you. Otherwise, we're chasing our tail and I'm just going to be another guy on the rung that you're going to go see. And if you take care of this problem and stabilize the foundation, the orthotics in your shoes are going to cause your knees to externally rotate, your hips are going to come back, your back's going to straighten out, and you're going to take the pressure off the disc and the nerve, and you'll begin to heal. It's going to take 3 months, but it's going to heal. And they do. 99% of them do. Some of them don't, and they 1%, 2%, they have to go to pain management, get surgery, or whatever it may be. But that's really what I'm finding. It's always in the feet.
Well, what I love is that you broke it down like, hello, let's bring this back. You're 30. Like, please do not accept this as just the norm. If you can't tell me that you had this, that you've been diagnosed with, some type of scoliosis, kyphosis, whatever, if you can't tell me you had this humongous accident a few years back, you're 30. And
Sometimes
you've been accepting this for 6 years.
I had a patient yesterday. He's a big guy. He's a really big man. I thought he was a little older. Hope he doesn't see this. He's a big man, 6'4", like steel, but his face looks very mature. I thought he was in his 40s. He's 27. And I was like, damn, but he's been in pain for 5-6 years. So from 22 to 27, he's done everything. I love when they say, I did everything. What'd you do? Well, I went to PT and then it didn't work. So my doctor sent me back to PT so it wouldn't work again. Then that didn't work. So then my doctor said, well, let's try some PT again. And then that didn't work. So then my doctor said, okay, we got to try something new. Try a new physical therapist. Okay. Then that didn't work. And then he sent me to PT.
I was trying to keep it together. Try the new PT.
Love you. Let me tell you something. But if PT didn't work the first and second time, it's not going to work the third time. Is there anything wrong with PT? No. I love physical therapy. I do it in the office. But if you're not fixing the underlying joint dysfunction and getting a patient adjusted, I don't know how technically you want me to get with your audience, but very simply, your spinal joints, if you recall from medical school, are very simply diarthrodial joints. The spinal joints have the facets on both sides.
Yeah.
Down the spine. They're diarthrodial joints. So I'm going to crack my knuckles. Okay. Same sound comes from your neck. And I'll demonstrate that with a patient. And I'll say, do you ever crack your knuckles? And they go, yeah, I do it all the time. Feel good? Feels great. Doesn't it cause arthritis? No. It used to think that it caused arthritis, but it does not. It prevents arthritis as long as you're not doing it all day long. Well, I forgot where I was going with that, actually. I got hung up on the adjustment of my knuckles there. Where were we? Bring me back.
You were saying that, so he's the one that had they kept sending him to PT over and over again.
Thank you. So he's going to PT over and over again, and I adjusted him for the first time, and I wish I videoed his expression. I usually have a little camcorder, and I get permission from them to let me video, especially the first adjustment on a patient that's never been adjusted before. Often so overwhelming. He was like, and that's all I needed to see. It was like, oh my God. Another lady broke down and grabbed her chest and started crying. I told them. They wouldn't listen. I told them there was something in my neck. I just knew it. Bursting out of tears. Another one got into a fetal position in the corner. She said, you don't know. I've been living with pain for 12 years. I've never had relief. You don't know. I was shocked. Didn't know what to do. I was so out of my element. I didn't see this. These are the things that are expressions of relief from a single adjustment. And that's really what it comes down to. It comes down to relieving pressure in the joints, bringing it back to the spinal joints being very similar to knuckles. It's no different. So it doesn't hurt to get adjusted. You'll feel great.
Yeah. So, Dr. Jon, let's talk a little bit more about the impact of stress. Like, do you directly and actively address stress as part of your treatment plan?
Yes, I do. So when I do a consultation, Dr. Judy, I have a list in front of me, and I really spend a lot of time listening to the patients. And I'll say things like, so tell me, do you wake up in the morning feeling refreshed? Yes or no? No, I never wake up feeling refreshed. Well, now we have to look into things like sleep apnea. What position do you sleep in? I sleep face down. No good. I sleep on my side. Excellent. I sleep on my back. Excellent. What do you do for fun? I crochet. I play pickleball. Okay. Are you happy? Real simple. Are you happy?
Do you ask that, Dr. Jon?
Yes. Are you happy?
Good for you.
Do you feel safe at home? How's your life going? Because I live like that. I have 3 beautiful children. And when I was in practice, my oldest is from 98. So I practiced for 8 years, from 1990 to 1998. I had no kids. Then Emily came along. And I went from working six days a week. And my thing, Dr. Judy, was I love being a father. I wanted to be home. I went from 6 days a week to 3.5. And my ex-wife's like, what are you doing home? I'm like, I'm crawling on the floor with Emily. She's going to paint my toenails today. She's going to play the game called All Cozied Up with Daddy. You know, there's nothing greater than that. I don't care. It didn't matter to me. So there's the riches. Okay. I didn't need to be a millionaire. I didn't need to have the Porsche. I didn't need to have this crazy. I needed to have my
Yes.
family and I needed to feel good, and it was enough for me. I never once sat down, and figured out this is what I need to do to get to this. It was just keep doing. Like, I don't write goals down. I don't know if that's a good thing or a bad thing, but for me it worked because I just found out what was good and I kept doing it. And I didn't need to meet anyone's criteria of did you hit your goal today? It wasn't like so balance. Yes, it was all about family, some work, some hobbies that I do. I fix cars. I ride motorcycles. I was telling you earlier, I'm getting into tattoos. So you got to live your life. It's not, I can make more money if I want.
Right.
But I know people like that. You do too. That can make as much money as they want to make and more money, and it's never enough. A lot of times they're getting away from their workaholics because they have issues they're avoiding at home. And I'm divorced, and
Mhm.
it was a tough time in my life. It was very tough going through that process. It affected everyone. No one comes out unscathed. And to this day, my greatest accomplishment is still being a father, and on the personal side, a dad, and of course, a chiropractor on the professional side. So it's about balance, and I think you get that with some age. You realize I gotta start enjoying myself.
Right, right. Because when it's all said and done, and when you look around, right, like you're not going to do the chiropractor forever. When it's all said and done, you want to look around and still have some meaning, right? You want to look around and say,
Yes.
I I was a parent to my children, and when I was in the heart of the deep heart of my stress, heading toward burnout, no joke, Dr. John.
When you were working for the hospital or so forth.
So I've had it multiple times. I would say the last time doing exactly what I'm doing now. It was just a matter of how I address stress, right? And I had to look at how I
Oh,
was dealing with it and how I addressed stress and how I was dealing with my boundaries. This is something I talk to people all the time. Before we talk about what other people are doing, let's see what can you change about how you deal with things first.
what did you do? Just curious. What was the biggest shift that you made?
The biggest shift was being very clear about my boundaries and not being so easy to let them slip. I'm a helper. I am a giver. I'm a helper. And
Yeah.
that could translate into putting myself last
Oh,
all the time.
you're like me.
Right?
You're a doctor. Yeah, we're healers.
Yes. Yes. I'm not a people pleaser, but I am a giver.
Yes.
Right. And so, and that translates in different ways. It translates in ways in your personal life, but professionally, you're always a team player and what that looks like. Right. And
Well, Dr. Judy, can you do this? Can you close up for me? Can you do this? Can you get copies of this for me? I'm sorry. I owe you one. And it
could you
got,
work a little later? Could you do this? Could you do that? And so and also you as physicians, we want things to be as doctors, we want things to be right, done right. We
yeah,
have this picture in our head of completion
yeah,
and perfection and things of that nature. And so things can be nonstop. So I had to first become aware of what I was feeling because I wasn't aware at the time it was happening. And I don't want to make it too much about me, but what made me aware is I had to sit down. I found out I had cancer and I had to sit down.
whoa,
And in sitting down and getting treated, that then became abutted with the pandemic and lockdown. So I had plenty of time now to sit down and really delve deep into how did I get there. And so it took work. It took understanding of how I got there. Now, what am I going to put in place so that I don't end up there again? Which is, of course, is not 100%, but you have to work on it every day. You have to work on yourself every day and stay aware
yeah,
every day and stop the same way you just said. I loved when you said, are you happy?
yeah.
That's something that I have to ask myself.
It's pretty
How you
simple.
feel today? Are you happy?
It's basic, isn't it?
It's very basic.
Can't lie.
Very basic.
You can't lie. They can't look at you and say, yes, they are. And when they're not, you'll see right through that.
It's very basic. How do you feel today? How's it going? And force yourself not to say, oh, I'm fine, when you're not.
Correct. That's society, right? What's up? How
Yeah.
you doing? I'm good. How are you doing? Good. No, not in my
Yeah.
office. That doesn't fly.
Right. 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 So just things like that. And so just to hear how, you're really, and that helps with the connection. Like I can hear how they're connected to you, right? Between you really listening to them, but also your sense of humor goes a long way,
I'm crazy.
right?
I'm
To
crazy.
helping people feel connected because you're a team, right? You're a team, and in a world where the insurance may not be paying for that. Oh, and I got to address that too, because I love how you said that. Like feeling good is we don't pay for that. We don't pay for feeling good, and I thought about it. I was like, that's true. It might pay for feeling better,
Yes.
but not necessarily feeling good.
Yeah. And it's been a dilemma in my profession. Still to this day, it hasn't changed much. Why are you here? What brings you in today? Oh, my back hurts. And that question and answer could have been played over the same way in 1990. It would have been great if there was more cohesion in chiropractic in the organizations, the American Chiropractic Association,
Mhm.
there's too much fractionation going on, and it's not as cohesive, let's say, as the AMA, right? So the message is not direct and firm. So people, you would think 36 years later would come in and say, hey, and actually, now that I'm thinking about it, it has happened a few times, just not enough. 5 out of 100 people that walk through my door will say, I just want to get adjusted. I saw someone getting adjusted on Instagram, and they looked like they felt bliss and they felt amazing. And I want to experience it. That's like how I perceived it would have been after 36 years of proper education about what chiropractic really is. But a lot of doctors drop the ball because it takes time and effort, and it also takes a conviction and a belief in them as to what originally brought them into the profession. That's what brought me into the profession. That it was all natural by hand, and you're dealing with the whole body. Again, it came down to this form. It's everything. So I didn't have to decide, do I want to be an optometrist? Do I want to be a physical therapist? I'm going to treat the whole body naturally.
Yeah.
What could be wrong with that?
Yeah.
What could be wrong with that?
Nothing. And even as you said, what brought you in today?
Yeah. What brings you in?
And then someone says, well, I've been feeling pain. In the medical world that we live in, then the question becomes, well, how long have you been feeling that pain? And the reason and if they tell you, well, I've been feeling it for 3, 4, 5, 6 years, technically that becomes like, well, that's chronic. What really brought you in today? Right? Because and it almost sets up your mind to say, well, you've been dealing with that all along, unless there's something different,
Yes, exactly.
right?
Reached a pinnacle, is what happened.
Unless there's something different, that comes back to we don't really pay for good.
Yes,
We pay for better, but we don't pay for good,
exactly.
right? So if you've been dealing with this for 6 years, then
Why now?
why now? You're used to it.
Why'd you come in now? And there's never been a situation where a patient doesn't have an overlay of some anxiety. It's always, one comes to mind. I had a patient come to me 2 weeks ago. She wasn't getting answers from the medical world. She has really nothing that sticks out to me as horrible. She had some back pain, but here's the kicker. When I sat down she had some back pain. She had some neck stuff. Nothing that was very defined and very, what I'll call, no hard neurological signs or nothing like that. You could see she was weather beaten. She looked like she just crawled out from under a rock mentally. And she wasn't addressing that. So I said to her, what's going on in your life? And she said to me, she lost both parents recently and all of that. The medical doctor she was going to and the physical therapist she was going to weren't even considering that. And I think I become a therapist sometimes. I feel like a therapist. I'm not.
I was about to say, Dr. John.
Listen, and I tell them, listen, this isn't therapy, but it's not as it's traditional therapy.
Mm-hmm.
But she felt really, I said to her, she needed encouragement. And I said, you're going to be fine. You're going to be great, Nicole. You need to deal with mourning. You need to process the mourning of what it was her mother died and her father's old, and she's worried. If he goes, she won't have another parent. And that's what it is. That's the problem. And it's manifesting in neck and back pain. There's nothing hard. There's nothing really wrong. I checked her neck and back. I was like, I wish mine was that good.
Mm-hmm.
We need to talk. You need to find a way to, she's so strong too, and so much willpower. I said, you don't know how strong you are. She needed that conversation.
Yeah.
So strong she is, so
Yeah.
beautiful. What a beautiful woman. And I'm like, my God, you're just like a ship without a rudder right now. You just need to get this. You need to, instead of worrying about your dad, you need to talk to your dad and tell him you're concerned about his health, because that's what's bugging you, that he's not taking care of his health. You need to verbalize it. That's what you need to do. You need to address it head on and not skirt around it because you're feeling all this cognitive dissonance, this anxiety of wanting to tell him, but not, because he's this very authoritarian, military kind of guy, and
Mhm.
not a mean personality. And that's what it was. And then you could see the next time I saw her, different woman,
Wow.
different woman.
That is really good. Now I'm gonna go into something just quickly. I hope it can be quick. I would be remiss if I did not ask about this because I always wonder, chicken or egg here,
Uh huh.
when we're dealing with the back, even if you're not having pain, the neck, the back. Dr. Jon, sleep.
Okay.
Okay, because this becomes a big factor in how people feel, is their problems with sleep. And sometimes that problem with sleep is positioning, but I don't know, is it the chicken or the egg? Is it the positioning leading to it? Is it the lack of sleep that's leading to
Good question.
the issue, and so what are your words around that? Because that has a humongous effect on how people deal with their everyday. That sleep portion, a humongous effect. And I know for a fact
Yep.
that I'm probably not using my pillow correct. I'm probably not using my pillow correct.
Tell me more about that.
Find I find that for me, nothing. I think the side is the part that feels the best, but it still doesn't feel great to me. Like, I try to curl my pillow under my neck, and then I have my arm up under it somewhere, and
Very. So right away, your pillow's too low to the ground for you. You need a higher pillow. We grew up, you and I, with our parents giving us these big, fluffy, beautiful down pillows. Take that and chuck it. Okay.
mm,
You need a pillow that has, a trough in it, like a bolster on both sides. There's one that comes to mind. I don't sell these, but there's one that's out there called the Tricore, TRI-CORE. It's been around for 1,000 years, and their logo is an apple, I think. Anyway, they've been very early on neck pillows, and that's the kind of pillow you need, and I need, and I use, because I don't use the Tricore brand, but I use other. You get on
yeah,
Amazon, you need a high enough pillow. So now if you and I are laying down on our side, we want our head to be as neutral as it is right now talking together.
right,
We don't want this. Because when you get this, then you feel like you got to scrunch it up and
yes,
head up. And then about 4 hours later, in the middle of sleep, all of a sudden that's not enough. And then you got this,
yes,
which you just showed before. Your arm's under there now. Now you got a scrunched up pillow and this, now your arm's numb.
yes, yes,
No, it's like, oh damn, man, that wakes you up. Shoot, my hand's numb. So we need to fill in this space with what looks like where's my pillow that I could show you? Okay, think of a football, that shape, a cylinder.
okay,
Big.
yep,
Okay, so to your audience, if they can go on Amazon and get a buckwheat hull, an organic buckwheat hull pillow, there's one called a Loft, Lofe. I don't sell these.
hmm
Lofe neck pillow, and it's a big sack that's the shape of a cylinder that you can control how high it is with the holes inside. It's got a zipper. You can fluff it up, take it out, and you can make it perfectly high. So when you're laying on your side, it's like laying on the beach when you get the sand put under there perfectly.
okay, yes, because the buckwheat moves around in it to, okay,
You get it just right, it's not going to move. It's sand. It's like buckwheat. It's not going to get soft like a Tempur-Pedic pillow with heat starts to get soft and it squishes away. The buckwheat holes are going to maintain the integrity of the height that you set it at, and you will sleep. And why do you toss and turn in the middle of the night? Is because you have pressure points. Your subconscious mind wakes you. It says, we can't go another hour like this. You're going to move. And all of a sudden it makes you move. You wake up. Now you're coming out of REM sleep and you disturb that. So sleep is chicken or the egg. It's really all encompassing. The mattress is important. The sleep apnea is huge. I have sleep apnea. I had it for many, many years. My ex-wife and kids used to complain I would snore and they'd hear me a mile away, and that was disturbing to them. And what was worse was I recall being asleep and then I'd stop breathing, and all of a sudden, I'd do that and scare the hell out of my wife.
It is not a nice thing to witness.
Ooh, it's
I
horrible.
can tell you that. It's
I sleep with a CPAP every night. I've been doing it for 10 years, and it's changed everything about my life. I feel great. So sleep, position is important when you lay down. The tools are the mattress, the pillow. You need to get adjusted. You really do. You will have a whole different take on and perspective when you get adjusted. There's nothing like getting adjusted and feeling it as opposed to me chatting with you about it
yeah.
constantly. You feel it. You feel it. You see the eyes. They're just, relief. Yeah. It's almost,
Best sleep ever.
yeah. The adjustment and the sleep, it's all tied in. It's all tied in.
Now, does Dr. Jon, the chiropractor, have a chiropractor?
Yeah, I do.
Yeah.
I do.
You walk it and you talk it and you walk it. Okay.
Oh yeah, no, I on average get adjusted once a month. That's maintenance care. I'm very particular about who I use. When you get adjusted by me, you've been adjusted. You know you've been adjusted. I'm not going to say it's like getting hit with a Mack truck, but it's close. It doesn't hurt. But after all these years of practicing on thousands and thousands of spines, I know my art. See, I'm a little crazy. I'm very, very particular about everything that I do that I love. So if I fix a car, it's going to be done the right way, my way. I don't care how long it takes. It's going to get done the right way. When I work on a patient's spine, I take them through it. We're going to work on loosening up your joints. We're not going to try and do it all in one day because it didn't happen in one day. We're going to peel it back layer by layer. We're going to take out the top dysfunction first, and then we're going to go for longer, chronic, more deeper things later. And the more we get to it, and on average, it's 13 visits to get you pretty much moving again. All the vertebrae that were stuck are now moving, and now you can maintain it. So I also get adjusted, and I'm very particular about who I go to. I find a lot of chiropractors have ego problems, and if I say to them, I want you to adjust me this way, and they're like, oh, I know how to adjust. Don't tell me how to adjust. I'm like, I'm telling you how I like to be adjusted. And if they push back on that, I'm out the door. I don't want to.
Right.
You got to grow up, because if you tell me how you want me to adjust you, I'm going to respect that.
Right.
That's it. So when you get a person who listens and says, sure, I'm happy to do it, that's the right person, providing that their skills are good enough. It's an art also. You have to have skill. It should never hurt to your audience. It should never hurt to get adjustment, ever. You shouldn't have pain after an adjustment. One lady came to me recently. She's a nurse. On the intake form, it says, when was your last adjustment? She wrote last week. To me, that's like, uh-oh, what happened? So she came in and she's like, oh my God, I left his office and I went into the car and I got these jabbing, stabbing spasms of pain right after the adjustment. And I was like, no, this can't happen. She was
ma'am.
out on FMLA and she had to get back at a certain time. And she's like, I can't do this. And she went online. I guess she read one of my testimonials and she found me reviews and she came in. And on that first visit, it was a 90-degree improvement, 91 visit. And she's still here now. And she was mismanaged. The doctor wasn't treating her holistically macro. He was tied into her sacroiliac joint when the problem was in her neck. Yeah. Anyway.
I have a couple more questions.
Yeah.
I usually ask these questions before we wrap up, Dr. Jon, because this has been so good. And like you said at the beginning, there are certain things that we could go on for like an hour and a half just on that one thing. But before I ask you those questions, for those of you that are still here and watching, thank you so much. Please remember to like, subscribe, share, and comment. And if you have not subscribed and liked yet, what are you waiting for? Okay, we would be happy to have you as part of the family. So, Dr. Jon, what do you, and it could be, you could decide professional or personally or a combination, what do you know now that you wish you knew then?
Okay. All right. I think I would say that I thought then that it was going to be a period of time before chiropractic was understood for what it is really, much more so than it really is today. And going back now, looking back, if I knew then what I know now, 36 years later, that it really hasn't. Okay, so the internet changed it. That's it. The internet changed it. So I'm not picking on medical doctors. I love you. Okay, we all have our place. But I'm going to tell you something. Before the internet, most medical doctors would say, especially the older ones, not guys like us, yeah, I don't know about those chiropractors, man. You better, I don't know, they could hurt you. I don't know. I don't know. And then the patient would be like, but doc, I've been going to PT for 5 years and it ain't helping me. And you're giving me Percocets every week and I'm still feeling like crap. I don't know about those chiropractors. I would go. So there's no internet. They don't go. Now there's internet. Now they go on and they see 4,000 other people that went, that took the Percocets, that are on the Percocets, that have the slip disc, that went to the chiropractor, had an amazing response. And now they go back to the same doctor and they say, whoa, where's my phone? Doctor, 1,000 reviews of chiropractors showing it helps for headaches. What brings you to telling me that I need to worry? And after a while, they stopped doing it. They said,
Yeah.
hey, if it works, try it, because they look like horses' asses.
Mm.
That out of not, it's just ignorance. It was laziness or ignorance. I mean, I don't know. If you asked me and I was in that position, I'd be like, listen, I don't know, try it. If it works, it works. I don't know.
Yeah.
Try it. I think it's reasonable,
Yeah.
So you asked me what I know, what I wish I knew then. I wish I knew that then that it was going to still be this bad, even in spite of the internet. And maybe I would have done something more on a larger scale, to educate more and more people, or started an organization, put more energy into it on a more meaningful scale, not just in my office, but the United States, for example.
Yeah. Yes.
Yeah.
Yes. 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 What do you define as excellence, Dr. Jon?
Oh, okay. Excellence is when you refuse to accept that what you know is all there is to know. So when I work with a patient and I'm looking at them, over the years, how I became very good at what I do. I'm very critical. I am an amazing chiropractor. And how I became like that,
Say that.
I'm an amazing chiropractor, Dr. Judy. I'm amazing at what I do. Absolutely off the charts, amazing. And how that came to be was I look at myself and I look at the results. And if it's not right, I changed something until it got right. I was aware. What did I miss? A constant detective.
Yes.
Self-aware. What did I do? What did I get? What did I think I was going to get? And what did I get? That happened just like that when I did this. Let me try it again. It happened again. I notice when I adjust this happens. So now when I adjust the patient and you're laying on the table, I have a sequence. I always do the neck first because of compensations. And I describe to a patient that you are now a living, breathing Rubik's Cube to me. You are on my table. There's colors everywhere.
Yeah.
And I'm going to make a change. And then I'm going to go back and look at the cube and see what happened. I'm not just going to blindly make an adjustment and say, I'll see you next week. So sometimes I'll go through your neck, your mid back, your low back, and then I do a final check to make sure that there's symmetry in your body creases, in the skin and everything, the skin folds, symmetry and everything's laying right. And after I go through it, if it's not, I miss something. And so that's excellence. Excellence is the refusal to accept it as the status quo.
I love that. I love that. Dr. Jon, it's been an absolute pleasure. I have learned a lot and am already thinking of, okay, where do I need to find the time to go get something done? Not only for myself, but I'm already thinking of family members. I'm already thinking of family members.
If you don't hunt me, I'm going to hunt you down.
Will do. Thank you, Dr. Sirota. Really appreciate it. Thank you, everyone that's here. I hope you learned something today. Please, again, like, comment, and share. And please do comment. We will reach out on your comments. And we will see you next time on the Balance to Excellence show.
Thank you.
Bye for now.